occupational health for small and medium-sized business.
I work in the construction industry.
I'm working within an NHS trust.
Just at the moment, I'm working for a police force.
I'm an occupational health nurse in the NHS.
I work for a university.
Varied background, acute care, ED, ICU originally, but also 15 years in practice nursing.
A nurse in adult nursing, a registered nurse in learning disabilities, and also
Started out in general nursing, a bit of ITU, then several years in operating theatres.
I started as an enrolled nurse, went on and did ophthalmics, registered nursing, terminal care and some orthopaedics as well.
I'm originally a surgical nurse by background.
Including general nursing and then A&E, and then I worked in Oman for the Royal Oman Police, and that's what sparked my interest in occupational health.
I went into occupational health really as a fluke. I'd finished an HND in business and finance and was going to become a personnel manager. I applied for a job at a pharmaceutical company and they offered me an occupational health nurse role.
And it was really quite by accident. I was asked to go and cover someone who was going to study for their degree course, and I moved into an explosives plant and worked there part-time at university and studied 2 years for my occupational health degree.
I was attracted to occupational health when I learnt a bit more about the profession after a few colleagues I worked with on a ward had become unwell, and after they had recovered they were helped to return to work via occupational health.
In an ophthalmic outpatient department, and a patient came in with an injury. The sister said that the occupational health nurse had saved the man's sight, and I thought that sounded fantastic and I wanted to do that.
because I wanted to make a difference in preventing illness rather than treating illness.
I've done nursing to work, but time to make a career change, which is why I did it really.
Very difficult to describe a typical day. We're varied from doing various immunisations.
We have clinics, we have inquiries from managers, we do health screening.
Other days we're doing loads of health surveillance.
Phone calls from Advice Line,
Management referrals, they help sickness absence.
But I see a whole range of people from a whole range of professions who essentially are having some sort of problems at work, and my role is therefore to try and advise them and help them stay well at work.
So I do a mixture of case management and some health surveillance and medicals on recruits.
Reports I've got to provide to management, on a lot of training and development for managers on how to get the best out of occupational health.
I would say that occupational health nurses are more focused on the preventative illnesses and diseases out there.
Variety, you meet lots of wonderful and different people for lots of different reasons.
Learning, because every day is a learning day, because learning is lifelong.
You really don't know what's going to happen from day to day, and you get to use a wide range of expertise.
Because no 2 days are the same, and that's what's really attractive about occupational health nursing.
And being able to help somebody who is quite passionate about their job get back to what they want to do, what they love to do, gives me a passion for my job and makes me really enthusiastic, because you can see the difference you make.
And the requirement to think and use the expertise that I've acquired and to apply it to the individual.
And funnily enough, someone discovered that I had an aptitude for teaching, and I was therefore asked to develop the course. I'm very, very proud of it.
Thing is when somebody's actually been absent, say 6 months, and we organise rehabilitation, return back to work, and the person feels more valued than they already are.
Okay, what I like most of the job is the variety. I'm learning so many new skills because I've only been in it for 7 months.
I've been in occupation for a long time, and I've started doing some work in things like evidence reviews and helping with national documents.
It's very satisfying to actually achieve something, to know that you've made a difference to somebody's life.
I would definitely recommend occupational health as a nursing career. It's varied, you meet a whole range of people from a whole range of jobs.
Yes, of course I'd recommend it as a career. I'm lucky that I've had work in the pharmaceutical industry, also in the BBC. I've worked for the police service. I've worked on an international role which has taken me to 27 different countries in the world, and now I work with the construction industry, and it's great fun.
I was working in the oil and gas sector, an offshore installation platform. Occupational health is a fantastic career. It's so dynamic.
I'd recommend it because no 2 days are the same. You've got potential for autonomous practice and you have to make lots of very quick decisions, and that to me is very stimulating.
If I had my time to do again in nursing, I would do it exactly the same.
Always be a jack of all trades. You have to have a good understanding of medical, surgical and the other areas of nursing to actually be a good, holistic occupational health nurse. Yeah.
I think if you're looking for a career in occupational health, it's a fantastic opportunity to develop yourself. Have a chat with your occupational health provider, find out a bit more about the profession, and a brilliant career could await you.
And in some cases, funding may be available.
So there you go.